Hello everyone, I hope each of you at your place is fine. Myself, Dr. Samad, working as a senior consultant physician at Galaxy Nursing Home with a total experience of 6 years. Today we will understand diabetes and its manifestations in age. Diabetic is a common disease and it belongs to all the categories and its manifestations, especially in itching. It means a main play role in the itching. We all know that how common is diabetic nowadays in general population. People with diabetic tend to experience itchy skin more often those without the condition. Persistent itching it may cause uncomfortable and might lead to excessive scratching, which can cause discomfort and pain. Itching is often symptom of diabetic polyneuropathy, which is a condition which may lead to nerve damage. Certain skin conditions that develop as a result of diabetes may also cause itchy skin. A person with diabetes should not ignore itchy skin. Dry, irritated or itchy skin is more likely to become or infect people with diabetes may not able to fight off infections as successfully as those who do not have this condition. We will understand reason why a person with diabetic have an experience itching offers in comparison to a non-diabetic person. What are the causes of diabetic itching? Diabetic can cause localized itching. There are several reasons by which person with diabetes experience more frequent itching than others. Often the cause of diabetic related itching is mainly a diabetic polyneuropathy or a peripheral neuropathy. It may cause irritation and tingling sensation in part where the nerve root is going on. The main role in diabetic polyneuropathy, which have studies shown nowadays, is increased level of cytokines. High level of cytokines circulate in the body. These are the inflammatory substance due to which there is a lot of skin itchy condition. Recent research have suggested that increase in cytokines may eventually have a relationship with the diabetic nerve damage, which I have already told you that diabetic polyneuropathy is one of the most manifestations of a diabetic person which may lead to itchy skin. People with diabetic can also experience complications such as including liver failure, kidney failure which may cause itching. Some people with diabetes may develop itchy skin as an adverse effect of a new medications or have an allergic reactions to it. Diabetic skin conditions. Diabetic sometimes an underlying skin condition can cause itching. People with diabetes can got certain conditions and infections more easily than people who do not have diabetes. Examples of these conditions mainly the fungal infections. Fungal infections such as athlete foot and jock itch can lead to itching. The yeast-like fungus such as Candida albicans is one of the most causative agent for our. In other words, we can say that it is the most causative responsible for these infections. Necrobiosis lipodica diabeticum NLD is a rare condition that typically develops on the lower legs, although it can also affect other parts of the body. NLD starts as a dull red spot which may raise surface of develops into a scar lesion with a dark border. It can cause pain and itching. Eruptive xanthomatosis, most common in people with type 1 diabetes. This condition forms yellow lesions on the skin are about the size of like a peanut. High cholesterol fat level, it may cause increased risk of eruptive xanthomatosis. Symptoms mainly include itching, very common and depend on the cause. For example, if a person has peripheral neuropathy, there are the more experienced itching in the lower parts of the legs. Itching can make a person feel uncomfortable in their clothes, wake up them in night and make them feel as it always need to scratch. Always mention about your diabetic condition when you meet your physician. Mainly the scabies is most common in now our population, mainly due to the unhygienic conditions of clothes and unhygienic conditions of the houses in the condition where the itching is most common leading cause of in these cases. In case of any medical urgency, kindly consult with your physician. Thanks a lot.